I hope you will enjoy hearing today's discussion with experts and community partners on lessons learned during the coronavirus pandemic and plans for a healthier future while navigating through COVID-19 in our daily lives. I'm excited to hear from the members of the public who are here today to share their experiences and ideas with us. Each person's point of view with COVID-19 was different. And being able to learn from each other's experiences will contribute to our being able to better prepare for the future. Founded as a 501c3 nonprofit in 1989, AASCSC was founded by Chinese American community leaders to address issues facing their aging parents with the philosophy of caring for elders as if they were our own. Since then, AASCSC has become a trusted community organization and partner with a history of ensuring our most vulnerable low-income seniors, refugees, and immigrants have equitable access to quality social and health programs and services. At its heart, AASCSC is here to help our seniors and community when they need us the most. I still remember when we were first coming back from the holidays on the first Monday of January 2021. We were hosting a support group for our seniors. We had participants throughout Orange County, and there was something in the tone of our seniors from Santa Ana that just sounded different. And I have to share with you that our seniors in Santa Ana, at the core, they are resilient. And it was in their face expression, in their tone, that we knew something was off. And now we know, during that time, it was the deadliest days of the pandemic. Exhausted medical providers reached out for help. They were done. You know, they really maximized all of the medical options at that time, and they were telling me that the seniors were not making it to the hospitals. Elderly couples were passing away together. And I reached out to Dr. Chow, and I shared what the seniors in the apartments were going through. And within a couple days, Dr. Chow and a team of county and community partners came to our center and hosted the first Sunday mobile vaccination clinic for our seniors. That was the first of many weeks of Sunday vaccine clinics. It was also the turning point in Orange County, encouraging the state to open vaccination clinics to our older population, allowing them to have a fighting chance surviving this disease. When vaccines were first available, AASCSC worked really closely with HCA to vaccinate seniors and the most vulnerable populations in Orange County. Though some were uncertain about receiving the vaccine, we had built trust with our communities over years of working together and asked them to please lead by example. Their willingness to be the first to be vaccinated undoubtedly saved many lives. We leveraged our relationship with senior apartments, senior centers, ethnic grocery stores, and essential workers to ensure that those on the front lines and most vulnerable would be protected from COVID-19. Since then, AASCSC has vaccinated over 32,000 residents from 27 unique zip codes through more than 220 community mobile vaccination clinics across the county. Just 2 days ago, we hosted a senior fashion show and vaccinated a clinic at Heritage Museum and vaccinated over 140 seniors and community members. The last 2 years has been especially difficult on Asian American seniors due to the COVID-19 health risk and increase of anti-Asian hate. Fearful of leaving their homes, Asian American seniors became physically and socially isolated. AASCSC support through home visits, food delivery, virtual events, and other services ensured that they would not be forgotten. AASCSC's work would not be possible without the support of numerous community leaders, healthcare professionals, and government administrators, many of whom made personal sacrifices to protect, heal, and care for the community members in response to the coronavirus pandemic. As COVID-19 numbers improve and we consider next steps, this is a tremendous opportunity to evaluate our response to COVID-19 and prepare for future challenges as a unified community. Lastly, I would like to ask us all to take a moment of silence to mourn those directly and indirectly impacted by COVID-19 and shootings across the nation, including Laguna Woods, Buffalo, Los Angeles, Dallas, Chicago, and Houston. The Laguna Woods shooting at a Taiwanese congregation meeting hit especially close to home because many of the members were elderly. AASCSC and I work closely with AAPI leaders, including Taiwanese community leaders to provide COVID-19 resources, including PPE, testing, and vaccination, as well as partnering to combat anti-Asian hate crimes through the pandemic. We are now working to provide mental health and other direct services to those impacted during this difficult time. Please take a moment to pause, reflect, pray, mourn, and honor those that we have lost. And it is with a grateful heart that I want to thank you all for your support, and we look forward to working together towards a more equitable Orange County.